Today, I would like to take you a journey of a lady who had undergone a very massive stroke of the brain. Her name is Asha Gore. It was a midnight story one day, a month or 1.5 months before. She had a very severe stroke in the brain with middle artery, cerebral artery, getting burst out. And a hematoma which was compressing on the midline made her life very challenging even for survival.
On the 19th of July, my mom was cooking food and all of a sudden she fell down. I mean, we were in the house itself. We went there in the kitchen and we saw her lying down. She had difficulties in breathing and we thought it's just a normal, she just fainted or something, and we were there. And within a few seconds or within some minutes, she lost her breath. When we reached there, we came to know that it was a bleed in her brain. There was a bleeding and it was bleeding profusely. Almost 70% of her brain was covered with blood and she had lost a lot of blood. Okay, and the pressure in the brain and the skull was so high that the blood was finding ways to move out. And that is when we realized her eyes were starting to get red. It was very difficult. It was a difficult time for us. She is improving because a connect is necessary. A family connect or a family bond is necessary. She is spending almost 4 hours here. I go to office. My wife goes to office. So we are working. We giving her time is very limited. Okay, wherein we have to rely on the doctors. I found the doctors out here would always treat her like their mother. It was so good. And I was never worried. Whenever she used to enter the hospital, I was never worried. I never called my dad again. I used to only call her, "Have you reached?" She didn't need assistance. She was trying to talk to us. She was trying to, the doctors had told her to do some kind of exercises on her own. And it was very stunning that she remembered those exercises. She was doing it completely by herself. And I remember from day 1 at StemRx to day 10 at StemRx, the journey was completely different. She was getting up on her own. She was walking on her own.
Asha Gore is a strong fighter, and StemRx protocol has done support to her fighting nature.
Okay, so we had was 1 year, 2 months old. He has come with a complaint of spasticity. Basically, he was diagnosed as cerebral palsy. He has come from the country of Burkina Faso. So when we started giving treatment, he used to hold his breath midway. During treatment, that was a little difficult for us. He was very cranky throughout the treatment. So somehow we need to divert him and give on and off treatment according to his cooperation. So right now, presently, the child has improved marvelously. So the improvement, what we have noticed at the time of discharge, first of all, we had gotten the control of the neck. That was a major thing which we had focused in. We had reduced his spasticity level almost up to 0. We had make sure that he is going into the crawling position. That we have started with the extension in the prone position, which has progressed to the crawling. We had achieved sitting almost 70 to 80% without support. He started giving eye contact when we started talking to him. He has started opening his eyes completely. He has started babbling and vocalizing also when you talk to him. So basically his cognition and speech has also improved. It is good to diagnose early the diagnosis or the symptoms what your child is suffering from, which will help us to treat better and give you result very early.
There's always a bonding relationship develops between the patient and doctor. It was not a relationship of patient and doctor. It was a personal relationship to see his growth. This is a beautiful story of Chris' journey where there was no hope, but he has now a beautiful life to enjoy this birth. Parents are happy. I wish.
As a parent, I started having issues with him in terms of trying to teach him new things, simple things like if I wanted him to talk or to communicate verbally, it was a bit challenging for him. He also had challenges with his attention span, which made it a bit tricky for him.
The protocol designed at StemRx for Sean was so critical, precise, to the point where the pathology is there. The pathology of neuroinflammation as well as mitochondrial dysfunction are completely changed for him, and his life is changed.
He was actually a very hyper child, where he never used to sit at one place. Then he was like flapping his hands, looking at the corner of the eyes, and jumping all the time. So typical features of all autism kids used to have it. So whatever therapies we are giving, stimulations we are giving, like magnetic, direct stimulations, microcurrents. So according to their progress, we decide the frequency, how it is to be going on. If it's required, we can increase the frequency, and if the child is becoming too hyper with it or overstimulations comes in, so we analyze it through their symptoms, and hence we reduce the frequency also. So we have started certain brain stimulations for him. We have started some magnetic stimulations, direct stimulations. We have also started microcurrents for him. Then this was the sandwich protocol made by Dr. Mahajan with stem cells, and then we have started with edge beauty also for him. So we started connecting and reconnecting with the environment which we had seen it. Normally in autism, they don't follow a pattern. They just go for one pattern only. The changes, they don't accept it. So in his case, he started accepting the changes, where he started coloring in different strokes. So that milestone he started achieving basically. He has started going to school. He started mingling up with his brother. He started socializing. He started playing. He started understanding the rules of the games basically, whatever the 3 years, 4 years old child play. Otherwise, before that, he used to be isolated. He never used to get involved in certain activities.
Masira, that I've learned from Sean's mum, and which was a light bulb moment for me, was that us as parents are so focused on speech and are so focused on basically that our child must talk, and we forget about all the other milestones that Sean has gained.
So, I learned from StemRx that you don't look at one thing to say, okay, I'm going for treatment because of speech. You have to look at the whole picture. But the whole hospital, the staff, you were very open and had empathy, and you managed to give me all the information, how I can assist him, and the amount of attention and assistance he used to get from his teacher, it has changed because he's now becoming more independent. So she was saying to me with Sean, if I give him a work to say do coloring, now on his own he can do the coloring and finish his work. And the funny thing, last week she was saying to me, Sean is the most attentive boy in the class.
So see Sean's progress now, that everybody says that Sean is not autistic.
He was a very, very hyper child with no speech. Today, after the two treatments of him with the stem cells as well as the new technology which we have got of mitochondrial function, he is completely recovered as a normal boy, and today he is going to a normal school.
There is no miracle out there that will happen. You have to follow through, listen to the doctor's advice, be patient enough to come for reviews, be patient enough to be honest, and not to expect the unexpectable. We have to work with what is real.